Well, the condition is benign prostatic hyperplasia, which is a relatively normal age-related enlargement of the prostate. It occurs in really the majority of men over 50 years of age. It can occur in men younger than that as well, but it's much more common over 50. And as the prostate enlarges, it tends to cause some urinary symptoms. It is important to know that there are a lot of men whose prostates can be enlarged without it causing a lot of symptoms, and that's fine because you can live with an enlarged prostate. Where it requires treatment is obviously when it is causing symptoms that are bothering the patient. Now, the symptoms themselves are generally reflecting the fact that the prostate, as it enlarges, actually compresses the urethra, which is the tube that carries the urine from the bladder down through the penis. So as it compresses the urethra, it makes it more difficult to pass urine. So the typical symptoms are hesitancy, which is a bit of difficulty to get the urine to start when you feel like you need to go to the toilet. The flow is often reduced, and there's often a sensation of incomplete emptying of the bladder, which means that you may find that you've got to go back to the toilet again to pass more urine relatively soon after you've just been. So that can cause frequency, it can cause people to get up at night, and sometimes you can get some urgency with that as well, where when you need to go, you've got to go very quickly, and in very severe cases, the control of the urine can even be a bit compromised, where you can't actually completely control the urine in a small amount weeks before you get there. Yeah, absolutely. I mean, I'd say roughly about 60 to 70% of men over 50 have some sort of histological or pathological enlargement of the prostate, but in fact only a minority of them will actually have symptoms that require treatment, and the rest of the men really just have a normal age-related mild enlargement, which really doesn't need any attention as long as there's no symptoms to speak of. And obviously, we just need to make sure that there's nothing else going on in the prostate other than benign conditions. No, it certainly, there is no real relationship with benign disease and cancer. They're two very different conditions. And just because someone has an enlarged prostate, which is benign, does not put them in increased risk at all of developing prostate cancer. As far as long-term problems that can occur from the benign enlargement of the prostate, there are a few. It can cause some long-term issues with the bladder. The bladder responds to the prostate enlarging by becoming sort of stronger. It actually has to push harder to get the urine out through a more narrow opening. And as a result of that, that can cause some changes within the bladder wall, which tends to reduce the bladder capacity, so you can't hold as much urine, and often makes the urinary urgency worse. And that's why some men who have very successful treatment for benign disease might still get a bit of frequency and urgency in getting up at night, purely because the bladder's been altered because of the obstruction. The other issue is that you can get what we call retention of urine, which can either be an acute retention where suddenly someone can't pass any urine at all and it causes pain, and they have to attend an emergency department in order to get the pain relieved. That doesn't tend to cause any long-term problems, but you can get a more insidious form of retention called chronic retention, where over a longer period of time, men leave more and more and more urine behind in their bladder until eventually they're leaving 1 litre or 2 litres in their bladder. The concern with that is that overstretch of the bladder can permanently damage the bladder and make it more difficult for the bladder to contract. But it can also put some back pressure on the kidneys and it makes the kidneys not function normally. So in a rare patient with chronic retention, you can end up with renal failure as a result, which obviously needs urgent treatment if that occurs. So there are a few long-term sequelae from benign conditions as well.